symptom disorder is a focus on physical symptoms such as pain or fatigue to the point where it causes major emotional stress and problems functioning. Risk factors are a negative personality trait, and demographic features are more prevalent in females, old age, lower education and socioeconomic status, as well as other risks are a history of sexual abuse or other childhood adversity, social stress, and reinforcing social factors such as illness benefits. She has just been diagnosed with conversion disorder. Adaptive personality traits make her more prone to this disorder, as there may be a history of childhood abuse and neglect. Stressful life events are often, but not always, present. There also may be neurological disease causing similar symptoms. These symptoms include numbness, blindness, trouble walking, or frequent experience of depression or anxiety disorders. The prevalence for conversion disorder is not known, but it is reported that for every 100,000 people in the population, there are about 2 to 5 cases reported. Conversion disorder is most common in rural areas, among poor people, and military personnel. However, among men and women, there is no indication of who is more likely to be diagnosed. Charlie. He has had a persistent cold for several weeks, and there's recently been reports of a serious flu illness. He is beginning to believe that he has a serious disease. He goes to the doctor, but the doctor tells him he is fine. He does not believe the doctor and says that he'll be going somewhere else for a second opinion. Visiting a new doctor and telling him what's been going on, he diagnoses Charlie with illness anxiety disorder, a condition that is characterized by obsession with a serious yet undiagnosed illness. He tells Charlie that he is interpreting the normal physical sensations into something more serious. Illness anxiety disorder may be attributed by major life stresses or a serious but ultimately benign threats to the individual's health. A history of childhood abuse or of a serious childhood illness may predispose to the development of disorder in adulthood. Prevalence for illness anxiety disorder of those who regularly visited their doctor over a 6-month to 1 year period reported that 3 to 8% of those people were diagnosed with the disorder. The prevalence among men and women is similar. The symptoms of illness anxiety disorder may be diagnosed with OCD, depression, or anxiety. Additionally, the concern for health could lead to the development of actual OCD because it features an obsessive nature of cleanliness. Lee and Samantha ask their doctors how to treat the disorders, and they receive similar responses. They give the option of psychotherapy, which would help to ease their physical symptoms if they're related to psychological distress or a high level of health anxiety. They also offer cognitive behavioral therapy, which has been proven to be the most effective. Cognitive behavior therapy examines and adapts your beliefs and expectations of health and physical symptoms, teaches how to cope and manage stress, improves daily functioning, reduces avoidance, and is effective for patients with depressive disorder as well. Neither doctors prescribe antidepressants, even though some doctors do. Medications rarely work. And working together is very important for people suffering somatic symptom disorder. Patients are likely to reject suggestions of a relationship between their condition and emotional problems rather than the physical. Because of this, physicians typically tell them that their symptoms are unrelated to life-threatening or disabling medical conditions. Learning about treatment options, Charlie and Samantha are much more relieved. They're reminded that they're not alone and that it does get better. After a little bit of time, they'll be back to their normal selves and can return to a happier and more stable life.
Created using Powtoon.